Hi, welcome to ToxTalks, where Talks rocks. I'm your host, Misty Wilkin, a nurse educator and scientist. My background is in chemistry, pediatric nursing, and I have been a specialist in poison information, or a SPY as they call us, for the past 15 years. SPYs are healthcare professionals such as registered nurses, pharmacists, and practitioners. In episode 1, we will discuss the Poison Control Center as an important resource when caring for the potentially poisoned pediatric patients. I just want to introduce the Poison Center a little bit. I'm sure y'all recognize Mr. Yuck. You've been around a long time. We don't make those stickers anymore, but it's still the same number. America's Poison Centers represents 55 poison centers across the country. We provide all Americans expert advice. We do maintain the nation's only near real-time poisoning data surveillance system, and we ensure a national quality standard for the detection, prevention, and treatment of toxin-related health emergencies. So I just want to discuss a few things that I'd like for you to get out of my little talk here, some learning objectives. I would like for you to recognize what is considered a poisoning, understand the Poison Center as a resource, and to know when to call the Poison Center. So what exactly is considered a poisoning? Well, according to Merck, a poisoning is the harmful effect that occurs when a toxic substance is swallowed, inhaled, or comes into contact with the skin, eyes, or other mucous membranes. If you look at the photo here, I just a couple common causes of poisonings in children. Of course, medications and vitamins. The pill minders look like little candy boxes to children. Pills in general look like candy. They tend to put them in their mouth and chew on them like candy. Fortunately, most of them don't taste well. But we still do run the risk of poisonings, especially with medications that are very toxic to children, such as cardiac drugs or heart medications, diabetic medications, and psychiatric medications. We're getting a lot of exposures of gummy, the vitamins or supplements such as melatonin, and also cannabis exposures in children because they're making them look and taste like food and candy. Household cleaning products get a lot of those because it looks like a beverage to children. They'll drink right out of the bottle of rubbing alcohol or Fabuloso. So definitely going to want to be calling poison control to find out how harmful the substance is. Plants and mushrooms, usually inadvertent ingestions or small amounts in children aren't a problem. But if they get enough of it, they can be a problem depending on type, so it is good to check with us. Alcohol, of course, can be dangerous for children, and e-cigarettes. Definitely want to give us a call for those. And of course, your pesticides and herbicides and fertilizers, products that you would normally find in a garage, those products can be dangerous as well. So definitely going to want to check with us on those. So you can see here on the photos, pills mixed in with candy, and they look just like each other. And then, of course, on the bottom right, the beverages that look like mouthwash. Easily mistaken, or cases of mistaken identity. So I just want to discuss why is it important to call the Poison Center as a resource for pediatric exposures. Medical professionals are available 24/7 to help you care for your poisoned pediatric patient. We're fast, free, confidential telephone consultation. And in 2021, 41% of our Poison Center calls were pediatric exposures. That's a lot of kids. That's a lot of 2-year-olds getting into everything you can imagine. So what exactly is the purpose of America's Poison Centers? Well, as you can see here, treatment, education, and prevention. We triage to avoid unnecessary trips to the ER. We save a lot of money and resources. We consult to discuss the patient's symptoms or scenario, sometimes to help with diagnosis. Recommendations are made for patient care. And we do follow up and document outcomes for research. And we continue to make further recommendations for patient care as needed. So by now, you may be wondering, well, who calls America's Poison Centers? Well, the public, like I was saying, half our calls are 2-year-olds getting into things at home. The parents call us and want to know whether or not they need to take their child to the ER or what they need to watch for. Institutions call us when they have exposures, chemical spills, leaks, any of that kind of stuff. First responders, once they get on scene, will call us, or police and paramedics will also call us just to find out what they needed to watch for or if the patient needs to go to the emergency room. And of course, nurses and providers call us to find out what do we need to watch for once the patient gets to the emergency room, and what do we do to treat these symptoms, and how long do we need to watch the patient. So definitely keep our number handy. And just a little tidbit, our calls are routed based on your area code on your phone. Next, I want to talk about when should you consider consulting the Poison Center. The types of things you should call us for, of course, are pediatric exposures involving ingestions, eyes and dermal, aspirations even, unintentional medication ingestions, and of course, we have a lot of intentional medication overdoses, unfortunately. Consider calling us for insect bites and stings, envenomations, chemical exposures, medication errors, drug-drug interactions, and also indications and dosage. Thank you for your time, and here are just a few references. And lastly, just a few resources. I am going to be coming out with an episode 2, and I will put the link in here once I get that done. Here's the Poison Center's phone number, and I've got a toxicology tutor website that's a great resource, information about toxicology, and also some more information about management of the poison patient.